upper cervical gets out of line, it can create muscular spasm and stuff that can begin to close off or choke off the eustachian tubes. It prevents proper drainage of the eustachian tubes. All right, so there is a mechanical component to that also, and that's why quite often people come in, their ears are all stopped up and clogged. We adjust, and immediately after you adjust, the ear opens up. That's because of that mechanical component of opening up. That has nothing to do with the immune system. The immune system doesn't work that fast. It has to do with the mechanical, open up the eustachian tube, the pressure immediately releases, begins to drain, the ear gets better. So there is a mechanical component to it, and really there's a mechanical component to all of this. But I focus more on this because this is the most important part, keeping your immune system strong, your body healing, your body repairing like it's supposed to, the more critical aspect of it.
44 years ago, we adopted a little boy that was 2.5 pounds premature. I feel I did much later in life that he was probably a drug baby, born in the 60s. And we finally, it dawned on me, I mean, I went to a chiropractor for years, but we had never taken him. And we took him. First I brought him to Amarillo, and they went through all the medical, and they said, you have over-anxious parents with a immature little boy.
Oh boy.
2nd or 3rd grade. But I knew then where I was taking him, and did you know, my mother said it changed his personality. He was like a rubber band fixing to pop. And then he just relaxed. It was like, I'm not kidding you, I know for a fact, he's 44 today.
Yeah. You can see it. I mean, anybody that brings kids, especially babies, infants in, I see all the time. You can talk to any chiropractor that's been in practice for a while that does treat infants and babies and stuff. You have a baby come in that's crying all the time and nobody knows what's wrong. You can start adjusting that baby. And the adjustment on a baby, guys, is totally different than what we do with you. It's a very low force line. You can contact that atlas and just with a little bit of pressure, and you can see immediately the baby stops crying, they relax. It has an effect. I mean, you just can't argue with those. Exactly what is going on in that baby, I can't really tell you, to be honest with you, because it's so hard with babies to know exactly what's happening.
Or he couldn't sit alone at a year old, and he didn't walk till 2. And I had no idea, what was going on. But finally, we took him, like in the 2nd or 3rd grade, I can't remember. But believe me, that made a believer out of me.
This stuff works, guys. It does. It really, not just chiropractic, but these concepts. And it's really, again, what I wanted to drive home to you is not chiropractic as much as the concept of what chiropractic stands for. Most chiropractors' kids that practice this stuff, most doctors like Dr. Roby and stuff that practice healthcare, you look at their kids and you'll see those kids are healthy. My daughter's never ever been on an antibiotic her whole life. She's 10 years old, never been on an antibiotic. My son's been on an antibiotic one time. That's because he had an infection. We didn't know what it was, and we were very concerned. We weren't sure what's going on. We put him on it for a short term. Once we figured out what it was, we immediately pulled him off of it. He's never been on one since. Okay, that's the way life is supposed to be. All right, most babies nowadays have been on 3 or 4 rounds of antibiotics before they're 2. All right, that's not the norm, guys. That's become the norm, but it should not be the norm. The norm should be healthy babies. Ear infections and stuff should not be occurring. All right, that's not just a variant. All right, that's a problem that's happening with these kids. And it's not always chiropractic, guys. Please understand that. It's not, and again, I want you to stress it. The adjustment is not the key. One of the biggest negatives I hear about chiropractic, and it is a negative, is chiropractors think they can cure everything. That is not true. Can the spine getting out of line affect every part of your body? Yes, without question. All right. Can it affect your heart? Yes. Can it affect your liver? Yes. Can it affect your kidneys? Yes. Does that mean it's the cause of every heart disease, every liver disease, every kidney disease? No. It's one of the pieces of the puzzle. All right. And if you get that piece in, it'll definitely move you further down that road to maintaining optimal health.
So extrapolating from that, though, then in your practice, then you do see some impact on metabolic diseases like heart disease or diabetes or high blood pressure when patients get adjusted.
Yeah, University of Chicago Med School just did a pilot study on blood pressure, and it's the first time a med school's done a chiropractic study correctly. And what I mean by that is they didn't do a sick study, they did a healthcare study. Here's what I mean. Normally in the past when they did blood pressure studies, because every chiropractor will tell you they can help blood pressure on most patients, okay? But whenever we do studies on it, the studies all come back very poor. And the reason why is because the way they do the studies, they go out and grab a whole bunch of high blood pressure patients, and they do exactly what they said. Group 1 gets the adjustment, Group 2 gets a fake adjustment, Group 3 gets nothing, and the results were horrible. What this study did, the first time they've done this, and this is correct, because this is the difference between sick care and health care. They went out and got a whole bunch of patients with high blood pressure. They brought a chiropractor in and examined their neck for misalignments. Patients that did not have misalignments in the neck were immediately eliminated from the study. Because if you have high blood pressure and no misalignments, I promise you an adjustment's not going to help you. You don't need an adjustment, okay? That's what we were talking about earlier. I'm not gonna adjust you if you don't need it, okay? Only the people that had high blood pressure and upper cervical misalignments were put in the study. They lowered blood pressure on average, I think it was 15 points, all right? Very effective then, all right, because it was done properly. It's not about treating blood pressure, it's about treating subluxations or misalignments. If there are no subluxations, I can't help you.
Where'd you say this was done?
University of Chicago Med School. You can pull it up on the internet. You just do a Chicago Med School blood pressure chiropractic on the search, it'll pull it right up. And from what I understand, they're now doing a bigger study that's gonna have a whole lot more patients involved with it. Be real excited to see what that does. All right, guys, let you guys get out of here. Any more questions, or if anybody has any more questions, I'll stick around and ask questions. Other than that, let's all go to Taco Bell and eat.
Yeah.